Today is a really important milestone on our journey towards Destination 2030 and our vision of great care for Central Queenslanders. A key part of that vision is our objective of great people, great place to work, and central to that is clinical engagement. Clinical engagement is a really important part of that vision, and today is the very first of our CQ Clinical Senates. Frontline clinicians from across Central Queensland will come together to help us shape the future of our hospital and health service. Today we'll have more than 40 doctors, nurses, allied health professionals coming together from across Central Highlands, Banana, Rockhampton and Gladstone to help us shape the future of our hospital and health service. Today's topic is about digital healthcare, digital transformation and the opportunities that that brings to help us to deliver more care close to home. So really timely, really important to us right here and right now, but it's just the first of the many topics that Clinical Senate will look at over the years to come. So a really important milestone for us. It's just one part of that clinical engagement. We've also spent a lot of time over the last 2 weeks out and about across Central Queensland at our local 10,000 Lives launches, talking to clinicians, talking to staff, talking to local communities about what can happen in Gladstone, Banana, Central Highlands, Billawheeler, Capricorn Coast, following the launch that we did at Rockhampton last year. We've also made a lot of progress around recruitment. We know how important that is on our vision of great care for Central Queenslanders and that strategic direction, Destination 2030. Last week we started the recruitment process for our Executive Director Medical Services, but we've made so much more progress. We've got a full complement of clinical directors here at Rockhampton Hospital for the first time in many years. Last week, I was also in Billawheeler Hospital celebrating the accreditation of that hospital as a rural generalist medical training facility. That allows us to transform that medical model, and we've already appointed to a first permanent doctor at Billawheeler Hospital. We're interviewing for 2 more doctor posts over the course of this week. And I believe for the first time in 10 years, this year, we will have a fully established, fully complemented medical workforce that are part of our hospital and health service at Billawheeler Hospital. We know that's transformational for what we can achieve in Billawheeler Hospital. Last year, we recruited over 460 staff to our hospital and health service. That's fantastic, but we always know there's more we can do. That's why one of our Destination 2030 projects this year is to review every single aspect of our recruitment process. So if there are improvements to be made, we can make them so that we deliver an even better experience and process to attract, to recruit and to retain the best staff into our hospital and health service. Another important part of Destination 2030 is our objective of great partnerships. This year we saw the very first of the Warrabinda Health and Wellbeing Partnerships that brings together all of the agencies, the services, the organisations involved in delivering care in Warrabinda together with the council and with community leaders to help make the maximum possible impact to support that community and improve the health, the well-being, the quality of life and the life expectancy of community in Warrabinda. You may have seen the recent announcement about the potential for a medical school right here in Central Queensland for the very first time. That's another really important partnership between our health service, Central Queensland University, maybe other universities on that journey of delivering the entire medical training syllabus here in Central Queensland to complement what we already do from a nursing and an allied health and a midwifery perspective. We've also been doing a lot of work with the Mater Hospital in Gladstone, where we share one campus with a public and a private hospital to see what else we can do to work together to provide even more care to residents of Gladstone and help in that journey to see 10,000 fewer patient journeys as we deliver more care right across Central Queensland. Just some of the examples of what we mean when we talk about great partnerships. In the last week, I've spent time here in Rockhampton Hospital, in our renal services and our cancer care facilities, at Emerald Hospital, at Gladstone Hospital, Billawheeler Hospital and Capricorn Coast Hospital. Every single service I visited, I was amazed, I was astounded at the passion, the care and the commitment of our staff across our hospital and health service. I'm really proud of what our patients, our communities and their families were saying about the care that you provide every single day. I'm amazed, I'm proud, I'm excited at what I see you do, and you should be very, very proud. Very well done for all of the work that every one of you does every single day across CQ Health on that journey towards Destination 2030 and great care for Central Queenslanders.